Ahead on First Look Asia, skin conditions, they're often very obvious and very visible. And for the millions who live with its effects, they also have to deal with reactions by others to their condition. So what can be done to reduce the stigma? Find out on Health Matters. That's coming up. Welcome back to First Look Asia. A mother and her daughter found themselves in an unenviable position recently when they were asked to exit a plane because of the daughter's appearance. Now, according to an account on the passenger's blog, the airline's staff said the little girl would potentially be a threat and may infect other passengers, when in actual fact, the girl was born with ichthyosis. That's a rare genetic skin condition that, while incurable, is not contagious. First Look Asia contacted the airline, AirAsia, for a response, and in a statement, it said the crew and ground staff had inquired about the girl's condition, quote, out of care for her. The carrier said it has a responsibility to ensure all guests are fit to fly and apologize for any hurt the incident may have caused. It adds that no guests were asked to disembark from the flight in question. Now, the incident brings to light the social challenges faced by those who live with various skin conditions. Just what types of skin conditions are there, and can a person tell when they are actually contagious? Well, here to help us dispel some myths and misinformation about skin disorders, we have skin consultant Dr. Ker Khor Jia from the National Skin Center in Singapore. Thank you so much for joining me this morning. You don't really think about it, but skin is the body's largest organ, and it is so visible. This child, as we heard, she was judged based on how she looked. Can you clear things up? What is ichthyosis?
Well, ichthyosis is a skin disorder where there's dry, scaly and thickened skin. It can actually be inherited from parent to child or acquired later in life, for example, due to cancers. But let us focus on inherited forms today. And for inherited forms of ichthyosis, it is noticeable at birth or during the first year of life and will persist throughout one's lifetime. And it can be inherited as a genetic mutation from parent to child, or at times the parents may not show skin disease, but they carry the mutation and pass it on to the child. And at times the mutation can even occur spontaneously at the time of conception. Patients usually have dry, scaly, thickened skin that's red and inflamed, and it can have painful cracks on the skin as well.
And so for someone who is not familiar with it, it can be quite jarring, quite surprising to see someone with this condition?
Yes, definitely.
So skin conditions or disorders, they can appear, as you said, dry, red, scaly skin. Rashes also, I'm guessing, quite common.
Yes.
For someone who is unaware about whether or not a skin condition is infectious or not, how can the public be better informed so they know what they're seeing?
Well, a lot of times it's difficult for the untrained eye to differentiate between infectious and non-infectious skin conditions. But in general, skin infections caused by, for example, bacteria, which is the most common cause, the skin is usually red, warm, and there's swelling, it's painful to touch. There can be pus or blisters. But in contrast, for example, viral skin infections caused by molluscum, they can actually be just bumps on skin, or viral warts, which are very common, can just present as hard growths with rough surfaces. And not all skin conditions, however, I must emphasize that red and scaly would be contagious, because a lot of patients live with eczema or psoriasis, and these are red and scaly skin conditions, but they are definitely non-infectious.
Those are quite common, are they not?
Very common.
Yeah. So as you mentioned, to the untrained eye, it is very difficult to tell whether or not a skin condition is infectious. Can you talk about some that are?
Yeah, like I mentioned, bacterial skin infections, for example, a condition called impetigo caused by a bacteria. These are infectious, and for example, very commonly athlete's foot, which is a fungal skin infection of the foot. These are infectious as well, although they are infectious, but they are not easily transmitted through a direct casual skin contact, so there's really no need to be alarmed.
So what do you advise your patients, your clients, to protect others around them, because they probably don't want to impact others as well? What steps do they have to take to make sure people around them are safe?
We would always advise patients to follow the treatment regimes prescribed that will consist of antiseptic washes, topical or oral antibiotics, and to cover the wounds with the appropriate dressings if they are wet or oozy. And as usual, practice good hand hygiene, like washing the hands with soap after doing their own dressings. Yeah.
It's so easy to quickly look at a person and judge them and not really know the struggle that they're going through. Can you tell me some of the stories that you've heard from patients in terms of the stigma that they face and how it impacts their quality of life?
Whether it's inherited skin conditions or conditions such as eczema or psoriasis, a lot of patients have scaly skin that sort of flakes off. And they would tell me, like on the public train, on the MRT, when they get up from the seat, they would leave a trail of scales on the seats, and people would be like alarmed, and walk away from them, and they really feel it, very badly.
How do they cope with something like that?
So they would have to apply a lot of moisturizers every day, and they would usually go out with long sleeves and long pants, even in Singapore's hot weather, because they don't want others to see how their skin looks like.
What other things can they do to educate people around them and to ensure that people are not afraid or they don't misunderstand their condition? So for instance, I'm thinking if you're traveling, perhaps have a letter with you at all times from a doctor, is that?
Yeah, so this is important to empower the patient with the knowledge so that they can explain it to others when needed. Definitely we can provide them with a letter like to the school or to the airlines to state that they are non-infectious or they are already under treatment.
So in the end, it really is about how the person looks, because if you have someone with a cold, say, on an airplane and you don't want to sit next to them, you can't really ask them to leave the plane, and same with those with skin conditions. Will the condition improve with age? This one in particular, the ichthyosis condition?
Unfortunately, it would persist throughout the person's lifetime. Yes.
Have you seen an increase in skin cases in Singapore?
In general, we are getting more patients every year at the National Skin Centre. Yeah, but for this, ichthyosis is actually a very rare genetic skin condition. Yeah.
What types of conditions are you seeing an increase of?
We are seeing a lot of patients with eczema and, for example, acne as well, both in the teenagers as well as in adults.
And why is that?
Yeah, I suppose more patients are aware of their condition and they come to seek treatment. Yeah, rather than sort of ignoring it. Yeah.
Okay, thank you so much for your insights on ichthyosis and other skin conditions. That was Dr. Ker Khor Jia from the National Skin Centre here in Singapore. If you have any questions, do let us know. Tweet us and use the hashtag FirstLookAsia.